So I just wanted to talk a little bit briefly about EveryLife and our Community Congress program. Many of you are already members of this program. This is a membership program of EveryLife. We have 3 working groups, newborn screening, public policy, and regulatory. And we bring industry and patient organizations together on major issues for collaboration and shared goals. The working group membership, we have total 151 members at present, pretty much divided between the 3, newborn screening, regulatory, and public policy. The majority of the membership is actually patient organizations. So as you can see, the majority of membership in each group are patient orgs, and then of course industry. Our regulatory working group is co-chaired by Isabel Lusada and Lisa Carlton. So for each working group, we have 1 industry chair and 1 patient organization chair. One of the projects that we undertook this summer was to survey each working group to make sure that we really understood where the industry and patient communities were at. And when we surveyed the regulatory working group, we had some interesting results. We had 32 total respondents to our survey. 21 of those were patient organizations and 11 companies. We found that just under half of the respondents had actually worked with FDA on a specific product, and that breakdown was 6 patient organizations and 8 companies. And of the 14 products that had been worked on, 10 were actually approved. There was a wide variation in terms of the level and type of engagement that different organizations had had with the FDA. About 1/3 of our survey respondents had been unaware of Commissioner Gottlieb's proposed reorganization to modernize the FDA. And over half of our respondents, when we linked to it and asked them to take a look at it, were unsure whether that reorganization would actually expedite approval for rare disease products. Over 90% of survey respondents who were familiar with the EveryLife goal of creating a rare center of excellence at the FDA thought that it would help the FDA to understand the challenges of the clinical design process and improve FDA staff expertise in rare diseases. We are currently planning to perform a deeper dive of those survey respondents because the data was so unexpected. Over 40% of our respondents were working through FDA's patient-focused drug development efforts and thought that it would improve drug development for rare diseases. And so there's going to be a meeting next month on that, and I know a lot of you are planning to attend at FDA. 32% of respondents, the majority, thought that a rare disease, that should say center of excellence, was the _1 thing that could be done to improve rare disease drug development. So today, we are here to discuss conceptualizing this rare disease center of excellence. We have perspectives on progress at the FDA, so we will be hearing from several members of the FDA and Vertex as well. Then we are going to have a panel on continued challenges at the FDA, and that will be the patient and academic perspectives. And then we're going to discuss continued challenges at the FDA with the industry examples. And we'll wrap up the day with a panel discussion that Frank Sasanowski, who is our EveryLife Vice Board Chair, will be leading a panel discussion on that potential model of excellence. So many of you had seen EveryLife, has been pursuing this for quite a while, this FDA Rare Disease Center of Excellence. And of course, the first goal was to make sure that the legislation authorizing its creation was passed, so that was done with 21st Century Cures, and then building community support, that clearly also has been done. And the next step is really to continue to engage key opinion leaders and experts like yourselves and the FDA on how we could develop and conceptualize this center of excellence. So the plan would be, of course, start small, start simple, avoid bureaucracy, engage Congress, make sure that FDA has adequate resources in terms of staff and funding to make this happen. And then this is just a slide where the staff got together and looked at what we've been hearing from industry and our patient partners in terms of what we want to discuss here today. Really thinking about how do we leverage expertise across FDA review divisions, make sure that regulatory approaches are harmonized, that FDA has the capacity to handle the complexities of clinical trial design, which is obviously unique for our community. How do we establish endpoints that are appropriate for our small patient populations? And then, of course, we want to figure out how can we increase collaboration with international regulatory agencies, make sure that clinical trial designs, especially for our community, are accepted across multiple agencies so that you're not doing one thing in the US and another thing in Europe, for example, and what can be learned from the successes and challenges that we've seen with the Oncology Center of Excellence. And so following this workshop, we are planning to flesh out a more detailed white paper, and you should all have Frank Sastanowski and James Valentine's first crack at this, which was disseminated along with the agenda, and if not, it is available right outside. It's just a 2-page summary that will be the focus of the panel discussion later this afternoon. And so with that, I'm not sure if Dr. Woodcock is here, but we would like to welcome Dr. Woodcock from the FDA to tell us a little bit about the CDER reorganization and its impact on rare diseases. So Dr. Woodcock.